Beta-phosphatium tricalcium is an alloplastic synthetic material. It means that it's a type of material that can fulfill all the main clinical and biological requirements when we need to do any sort of GBR, that means guided bone regeneration. Also, we should say that beta-TCP is one of the most documented material, and we have many studies regarding the use of beta-TCP in several indications of use, and also it is well documented the amount of the full resorption of it. One very interesting aspect of the beta-phosphatium tricalcium is also the rate of the resorption compared to the bone formation. Because in this study what we can clearly see is that at the beginning the autogenous bone, that is always been considered as the gold standard, has a perfect bone formation, but after a certain period of time the final result is, because of the resorption, that we have more bone formation when alloplastic material, and especially beta-phosphatium tricalcium, has been used. Also, what we have to clearly understand is the importance of the surface characteristic of this kind of material. And it is important to see that the macro and micro structures of the granules of the beta-phosphatium tricalcium is really a perfect material that will allow us to have a right resorption and in the same time the right bone formation. And one more interesting aspect of the R.T.R. is the different available packages that we can have. For example, when we do a normal post-extraction treatment, the use and the application of cones allows the dentist to have a very friendly use of material, and it will be very easy to put the material itself inside the bone defect. Also, we have the traditional granules of the pure beta-phosphatium tricalcium that can be presented as a syringe as well as a traditional form of packaging. Among all of the existing studies of beta-phosphatium tricalcium, we have also two recent studies done by my group, that is multicentric studies, and we will see now some of the cases that we used to publish in these studies. The first one is a very easy and simple cone use for keep the ridge dimension after a normal extraction. What is really important to understand every time in which we use this kind of materials is the perfect respect of the surface characteristics. That's why I really strongly recommend to have some appropriate and specific instruments in order to compact the material inside the defect, avoiding the risk of damaging the surface and the profile of the granules. Also, we need to remind that our material is an osteoconductive material. So what we do expect is a full resorption of it, and that's why we don't have to compact, to press too much this material inside the defect, because we want to keep the right space between granules in order to allow the new cells growth and the blood supplies comes between the granules. And also in these X-rays, what we can see is a sort of over-treatment of the defect. When we use this kind of products, we have not to limit our treatment to the previous ridge dimension, but we have to put something more, because we have to consider the resorption dimension of the material, and what we expected to have as a final result is exactly the previous level of the ridge. In the following case, we can see the use of syringe. When we use the syringe, it is important to take all the advantages of this kind of packaging. Syringes comes with a sort of filter at the top of it, so we have to keep this filter, we have to move to the effect and to aspire some blood in order to let the granules be weighted by the blood. It is not necessary to have blood along all the syringe, but all the granules that we expect to use need to be weighted by the blood of the patient. After that, we take the filter off, and directly with the syringe we move to the defect and we inject the granules directly inside the defect. And once again we finalize our treatment, putting and compacting the material in the appropriate way with the right instruments. A final suture is always recommended. Also, if because of the right kind of material, we don't need to cover completely the defect, and the sutures is only intended to approximate the two sides of the flap. Another case of the use of the syringe is nice to show how when we use R.T.R. compared to some other materials, we have a very good healing of the soft tissue. It means that R.T.R. is not against or is not in contrast with a proper first closure healing of the flap. And this is really important for us, because this is one of the most important moments during the regeneration treatment. One more lovely case is the use of granules in a sinus lift. In this case, we had no primary intention of situation of the implant, so we had to put the implant together with the R.T.R. And after a proper follow-up of the case, what is lovely to see is that as a final result, the ESQ coefficient of this implant, that I want to underline, totally positioned in a regenerated material, the final ESQ is really very high. So we had a perfect healing with a perfect new bone formation. And also we can have the use of granules for a vertical regeneration together with the use of membrane. And this case is showing how R.T.R. is easy to use in some very difficult and advanced cases as well. As a conclusion, I would say that R.T.R. among the beta-phosphate untitricalcium material is one of the best products in my personal experience, because it's a very safe material, fully resorbed after a reasonable period of time. It's easy to use because of the 3 different existing packages, and also last but not least, it's a non-expensive material. Not to be too expensive means that it is more easy to be offered to our patient, and that allows us to use the R.T.R. in many more clinical cases. After that, I only want to wish to all of you in the future many new millimeters of regeneration.